As new nurses, sometimes you need a little help from a senior nurse. Nurse Patsy to the rescue. Watch this true scenario and see what takes place. Hi, Miss Patrice. Can you please check room 333's blood sugar for me? Get your own darn AccuCheck. What? I'm definitely going to be reporting you to the manager. You, Miss Patrice, come and take a seat next to me. I saw what happened between you and this new young nurse, and I didn't like it, so I'm talking to you about it. Even though she's younger than you and she's new, it's still within her scope as a registered nurse to ask you and delegate stuff to you to get the blood sugar. I know you can do better, and we can work together as a team. And if, for example, you're overwhelmed and you have other stuff going on, just tell her or tell me and I will jump in and help you. No problem at all. We all have to do what's for the best of the patients. Okay? And I will also talk to her. Nurse Patsy. Yes, I tell the new nurse to get her own blood sugar. She's so lazy. She just sit down there not doing anything, telling me do this, telling me do that. And she's so younger than me. She has just an attitude. Do this and do that. You're right. It's in my job to listen to the nurses. I'll go and talk to that new nurse. And I'll go check the sugar and do better next time. I just don't like when young people tell me stuff. I don't like it. But it's part of my job, and thanks for talking to me, Miss Patsy. I went there with her blood sugar. She said she get my own blood sugar. I definitely should be reporting her to the manager. You, Nurse Lisa, come and take a seat next to me. I saw what happened between you and Miss Patrice, and I'm sorry she said that, and I saw that you were crying about it. I spoke to her, and moving forward, we're gonna work better as a team. Here, I have something. I want you to give this to her. Here, it's her favorite. Give this to her on your behalf. Okay? I know, I'm not saying you're at fault and bribing her and trying to win her with stuff, but sometimes a little kindness goes a long way. So just show her kindness. You never know what another person is going through. So here you go. Give it to her. All right? Yes, Miss Patsy. Yes, Miss Patsy. But I don't see why I have to be a bigger person. I'm the nurse. She's a nursing assistant. I'm supposed to tell her what to do. You're right. I will go and talk with her, and I'll give her this treat that you gave to me. And thank you for your help. Thank you. Hi, Miss Patrice. I have something for you. I know we had our differences, but I can see you had a lot going on. And I hope we can work this out going forward. Here you go. Enjoy. Thank you. This is for me. How do you know that I love this so? Thank you so much. You know what? I'm going to check your patient's blood sugar. Oh, you get it already? You got it already? Okay. Well, thank you for getting it. And in the future, I am not going to react that way. I had a lot going on. I was feeling stressed. And just a lot going on. And I reacted badly. And you're doing a good job as a new nurse. I hope you can forgive me and we can move on. And yeah, thank you. I definitely will make some of this for me and you tonight. And instead of our sugar a little bit. Hi guys, Nurse Jello here. Delegating as a new nurse can be very challenging, as you've seen in this skit. It's not your basic nursing 101. You don't always tell a nursing assistant or someone, hey, can you do this for me? And they say, yeah, sure. It doesn't always go like that. And that's why it's important to know the resources that you have in the hospital and utilize them. For example, here there was Miss Patsy, a senior nurse who saw what was going on, and she jumped in. She worked with this nursing assistant, Miss Patrice, for a while, and she was able to step up and say, hey, that's a new nurse. It's still within her scope to say to you, hey, can you get that? And you're supposed to say, okay, sure, no problem. But as you can see, Miss Patrice was having a bad day. She took it out on the new nurse, and it didn't go so well. So luckily, Miss Patsy was watching and observing and was able to work with the new nurse, Miss Lisa, and was able to work with the nurse and assistant and get them on the same page. And so if that happens to you, if you're delegated to a nursing assistant, or you feel like, or you're a nursing assistant and you feel like the nurse that's delegating to you is being rude, use your resources. Don't bottle it up. Talk with somebody that you trust and get pointers. And always take the route of kindness, of love. It sounds cliche, but it works. When you attempt a difficult situation with love and compassion, and you try to see yourself from that other person's view, it does work. It always works for me, and I know it will work for you as well. Thank you guys for watching. Bye.